Hi and welcome back. It's been a while, I know. Just a reminder, I'm Stephen Spencer, and this is, I believe, the fifth in a series of short videos I put together to talk about my prostate cancer. Hang on, the dog wants to come and say hello. Come on. Oh no, it's too far to jump. He'll come round in a minute. It's been a while since I did an update. Is kind of in line with the rate of improvement or change. Let's call it change, not improvement. My surgery was on the 23rd of January this year, 2019. Today is the 21st of November, so pretty much 10 months since my surgery. And in the first days, weeks, 2-3 months, change happened very rapidly, and I suppose a bit wishful thinking. I was hoping it would carry on happening rapidly, but it didn't. Everything slowed down. Can you sit down? Yes, good boy. Everything slowed down massively, and the rate of change, which was all positive, but the rate of change has slowed dramatically, exponentially for the mathematicians out there. So where are we now? I think when I last, I haven't gone back and re-watched the last little video blog I did, but I guess it was at about 3 months, and I was still in, there was some pain, there was a lack of continence. I was talking about the drugs that we were trying out, and that's where we were with it. Right now, let's tell you where I am right now. I feel relatively fit. I feel relatively healthy. I'm continent, all barring the very occasional coughing fit accident. That's been for about a month or so now, so I suppose from about 9 months for me. I know some people will happen a lot quicker, some people it might take a lot longer, but the good news is it does get there in the end. I remember the early days after the surgery, particularly after the catheter was removed. I thought I was never ever going to have control of my bladder again, but the good news is I have. So all of that's normal. I've just had another PSA test, the sort of 9-month, 10-month PSA test, 0.03 nanograms per milliliter. Again, which is what it has been consistently for 3 months, 6 months, and 9 months now. I've been to visit my surgical team and had a chat with them a couple of days ago. They're happy, as you can be, and as you might expect. They're content that the PSA is demonstrating everything that the surgeon surmised when they did the surgery, and the pathology confirmed afterwards, which is that the whole of the tumour was removed. Prognosis, we're on a steady line now of do another test in 3 months at the anniversary of the surgery, and then maybe 6 months after that, and maybe 6 months after that, and so on. At this time, we're not expecting to see any change. It's obviously settled down. The difficulty is that the surgery found that the tumour had invaded 2 lymph nodes. 16 were removed from mainly on my left hand side, but 16 were removed in total, and 2 had signs of the tumour invading them. The risk there is that cells from the tumour will have got into the lymphatic system. They'll be circulating in my body. While they're not established anywhere and they're not growing, there'll be no PSA, but because they're prostate cancer cells, if they do start growing somewhere, then it will spike my PSA blood test. So it'll be obvious at that stage. But at this moment, I'm just trying to try and live a normal life, I suppose, and continue to get fitter. What's become clear when it comes to fitness is that there are going to be some limitations. The removal of the lymph nodes affects the way that my legs feel. And I'm a cyclist, and I've cycled all my life. And what I've noticed since the surgery is that I'm struggling with stamina and cramps and things like that. It's not to do with blood supply, but it is to do with the way the lymphatic system removes waste products. And it was explained to me like you've got a 3-lane motorway going into your legs and back out again. And when it's all working properly, the flow of energy in and waste products out is balanced. But I've got all 3 lanes going into my legs open, blood flow and everything, all the energy delivery into my legs is good, but I've only got 1 lane open on the way out. And so I get a build-up of lactic acid and things like that. And I need to do some more research on it, but from what I can see, that's not going to change. That's something I'm going to have to live with. It wasn't something I expected. It wasn't something that was explained to me before the surgery. So it's been a bit of a shock, and I need to understand more about it. I'm going to go away and do some more research on that. I only found out about this when I was talking to the surgical team on Tuesday. What else is there to tell you about recovery? Erectile function, dysfunction, ED. I think I suggested in my last video that the drug therapies, the sildenafil and Levitra and the other one, sildenafil, basically combined drug therapies which you take orally, which they dilate blood vessels and they affect some hormonal change which hopefully enables you to have an erection, a natural erection, if you've had nerve sparing during the surgery. Now my surgery was substantially nerve sparing, not entirely, but 80%. Bilaterally, 80% of my nerves were spared in the surgery. But the drugs which are used in the sort of rehabilitation therapy have been horrible. I can't tolerate them. You take the usual prescribed high doses, which is what's prescribed right at the beginning of or right directly after the surgery. Give me a banging headache, hot flushes, disturbing visual changes. Everything becomes really bright because your pupils are dilated. You get severe nausea, usually at about 1 or 2 o'clock in the morning after taking them, and all of that, feeling like the worst hangover you've ever had. And it has no perceivable effect on erections. So, basically it didn't work. About 3 or 4 months ago I went to see the andrology clinic, the clinic that deals with men's sexual health issues, and they suggested as a trial I should try the sildenafil on a very low daily dose. Basically it accumulates, what I discovered was it accumulates over a period of about 10 days to 2 weeks to give you the same banging headache and everything else that you would have had if you'd just taken it once a week. So that didn't work either. The NHS were kind enough to supply a pump, which is fundamentally it's used to encourage blood flow and make sure you don't get any atrophy in the blood vessels, so that if and when your natural erections recover, you haven't seized up. basically. So there's you may, if you're in this situation and you're wondering about this stuff, you have to ask for your GP for a referral to the ED clinic or andrology or whatever they call it in your health area, and have a chat with the guys there, and they'll issue you with a piece of kit. Pretty rudimentary. I'll go and get it right now, but you can probably Google it and see what it is. They'll give you an exercise routine, which you may or may not decide to follow. It's entirely up to you, but it is actually critical, because what it does is stop the atrophy in the soft tissue, in the soft muscle tissues, which are not getting properly exercised, why you can't have natural erections. So until they recover, and by the way, if you've not had a nerve sparing piece of surgery, then they'll never recover. You can't have a natural erection if you don't have nerve sparing in this surgery. So assuming you've had nerve sparing, then you should recover a natural erection, and then if you've done the exercise, then you'll be able to do what you want to do with it. What else do I need to tell you? There's that. That might be it, actually. What do you do after 9 or 10 months after such a massive piece of surgery? I think the next thing is that you seriously have to look at what you're doing with your life, and I've had to do a big chunk of that. For nearly 6 months I couldn't really work properly, and that affected my relationships with the people I work with. I ran a small construction company. Basically that's gone now. I'm working on my own, very, very small scale, just pottering around with a van full of tools, doing some nice carpentry work, which, I enjoy doing it, but it's not what I had before. It does affect your mental health. I was, prior to the surgery, I'd never given my own personal mental health issues a second thought. I didn't really have any. I just worked from one day to the next, and I don't think I ever considered I had any kind of mental health issues. I am very conscious now, 9-10 months after the surgery, that I do have some issues, which I'm going to have to work out how I work them out. Some of them are to do with anger. Some of that anger is to do with just feeling broken, and some of that is to do with the sort of natural male testosterone build-up, which is so difficult to get rid of when none of your bits are working. So far I haven't come across anybody who can help me with that. No advice or anything like that, unfortunately. As I say, I think this is something you have to acknowledge, and once you've acknowledged it, then you've got to be able to work out some way of living with it, or maybe, hopefully, in the long run, fixing it. So going forward, it'll be racing up towards Christmas now, and then it'll be the anniversary of the surgery. We'll do another blood test, another PSA. Completely expect it to be a 0.03 again. In the meantime, we carry on working on erectile function, and being honest with myself and those who are close to me that I'm struggling emotionally. Mental health is an issue. And I think that's it. You might be interested, maybe you're not, but you might be interested to know that seeing as I can't ride my bike as much as I used to, that it hurts so much that I'm not really enjoying it like I used to. I've had to find myself a new thing to do, and so what I've done is I've gone back to something I did when I was a teenager. I've always loved music, and I've always loved music production and presentation and all that kind of stuff. So I got myself a job volunteering on the local community radio station. If you're interested in having a listen in, You can look up my Facebook page for that role, facebook.com/ICR Stephen, ICRSTEPHEN, and there's a Mixcloud and all that kind of stuff. And that's basically what I'm doing to entertain myself while I try and feel better about life, the universe, and everything. So I hope you're feeling good. If you're watching this because you're going through the same process that I have been, then stay strong. Talk to your friends, talk to your relations, talk to yourself, talk to your camera, talk to me if you want. Share your problems. They're much easier dealt with if you can share them. If you're watching this because you're wondering if you might have prostate cancer or that kind of thing, then all I can say is you don't need to talk about it at this stage, but you do need to learn about it. And if watching this hasn't given you enough information, then go and Google prostate cancer symptoms, and you'll probably, if you're in the UK, you'll probably get the Prostate Cancer UK website, or somewhere else in the world. There'll be some help out there, and go and get it dealt with, because the earlier you get it dealt with, the less damaging it is. That's all I can really tell you is you don't need to talk about it, but you do need to know about it. Good luck. I'll speak to you all again soon. Thanks for watching. Say goodbye, Jack. Oh.